Something very special for our country. Today, Toronto is the first city in the world to host a day that's focused on recognizing the impact of racism and prejudice on Black Canadians. Joining us this morning is Paul Bailey. He's from Black Health Alliance. Good to have you here with us this morning.
Morning.
First in the world, City of Toronto leading the way. How did this idea come about?
Well, it came about from the Confronting Anti-Black Racism Plan based in the City of Toronto. A number of community stakeholders were gathered by the city and Taboo Community Health Centre in Malvern. And really, we were trying to find a way to have this conversation about racism and mental health. And we felt it's not easy to do a simple campaign on this topic. It really needs a day, and it really needs an opportunity for folks to come together and have various discussions and engage, Torontonians of all stripes, in the conversation.
For some, this will be the first time they've engaged in this conversation. So if you can, inform us about the impact of racism on mental health, specifically in the Black community.
Well, racism has a particular impact in a number of ways. Studies have shown that interpersonal acts of racism has an impact on people's mental health in terms of stress. It also impacts the way people access care, right? So there's an issue of service deserts where in certain communities, let's say in the City of Toronto, you could say Rexdale and Malvern, folks don't have access to the type of services that they need, culturally appropriate, trauma-informed, and responsive to their needs.
I remember working with Bell Let's Talk Day and talking about how sometimes there just aren't enough Black therapists, for example, and somebody wants somebody who might both racially and culturally identify with them. What can we do to improve that?
Well, there are a number of barriers, and so definitely just trained staff who relates to folks is one of the things. One of the things that we're asking for, specifically for the provincial government, is to increase funding for community-based mental health services where people can be served in communities as opposed to inside hospital. We think that a small investment in those services will we'll be able to provide basically address those geographic issues, but also hire staff that will be able to relate more to folks who have very specific kinds of needs. We have identified the problem. What happens next? So right now, today, there's events happening all over the city, from CAMH and the city to the UFT Black Medical Students Association. Folks can find more information on blackmentalhealth.ca. Really, what we're trying to do is to engage folks in our conversation, try to raise some awareness, and then arm people with the information and language to continue to advocate for change. Paul, can you give some specific examples for anybody listening to this conversation thinking, how is Black mental health and the struggles that are faced by that community different than mental health overall? Like, what are some of the specific areas of impact? I think that's a very, very important question. I think mental health impacts everybody. There's a big conversation about wait lists right now, and that's an issue that needs to be solved. But what we're seeing is that Black Ontarians have a 60% increased risk of things like psychosis, that we face the most aversive pathways to care, and that means, where some folks may be referred to mental health services by their family doctor, we often tend to be referred through the police, ambulance, or through the emergency department. So when you kind of compile all of these statistics and these experiences, you realize that while mental health impacts everybody, there's a very specific way that mental health impacts Black Ontarians or Black Torontonians, and that's what we're trying to raise awareness about today, and hopefully get the government to respond effectively to. Well, the first of its kind in the world is starting here in the City of Toronto, and you're part of that. Paul, thanks for coming in today. Thank you very much. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.